Welcome back, everyone, to the deep dive. Today, we're going deep into something I think we can all relate to: tummy troubles.
Hmm. Oh, yeah. Everybody's been there.
Exactly. And the meds we use to, deal with them.
Right.
You sent over some really interesting stuff, actually, a pharmacology lecture and some notes in PDF format. So, the goal today is to really understand the key points about some common conditions:
For sure.
peptic ulcers, the nausea that sometimes unfortunately comes with chemo, diarrhea, and constipation.
Yeah.
We really want to give everybody a clear picture of like what these conditions are, how they're treated, but without getting lost in the weeds.
Yeah. Not getting bogged down in too many details, just the key takeaways.
Yeah. So I guess the first thing to tackle would be peptic ulcers. What causes those?
Yeah. So when it comes to peptic ulcers, there are a couple of main culprits. One is infection with this bacteria called Helicobacter pylori.
Oh yeah, H. pylori.
H. pylori. It's pretty common. And then the other big one is the use of NSAIDs, those non-steroidal anti-inflammatory drugs.
Like ibuprofen and stuff like that.
Exactly. Ibuprofen, naproxen, aspirin, things like that. So, a lot of people take those for headaches or muscle pain, but they can actually irritate the lining of the stomach.
So it's like you're trying to fix one problem and you might end up with another.
Yeah, unfortunately, that can happen. But it's not always just those two things. There's also the role of stomach acid itself.
Right, because we need stomach acid, but too much can be a problem.
Exactly. Normally, our stomachs produce acid to help digest food,
Yeah.
and the stomach lining has this protective layer of mucus that shields it from that acid. But if that protective layer gets disrupted, the acid can start to eat away at the lining, causing an ulcer.
Ouch. So I guess the treatment would depend on what's causing the ulcer in the first place.
Absolutely. If it's an H. pylori infection, then the first goal is to get rid of that bacteria, and that usually involves what's called triple therapy.
Okay, so that means three different medications at the same time.
Exactly. A proton pump inhibitor, which we often call a PPI, plus two antibiotics. Usually it's amoxicillin and clarithromycin.
I've heard of those. Those are pretty common antibiotics, right?
Yeah, very common. And the good news is that this triple therapy is very effective.
How effect?
Usually 90% or greater eradication of the bacteria.
Wow, that's impressive. So that takes care of the bacteria. But what about the stomach acid?
Right. So even if you get rid of the H. pylori, you still need to reduce the acid production to allow the ulcer to heal.
Makes sense. So how do you do that?
Well, there are a few different medications that can help. One class of drugs is called H2 receptor antagonists.
Like cimetidine. I think I've heard of that one.
Yes, cimetidine is a classic example. Basically, these drugs block histamine from attaching to certain receptors in the stomach, which in turn reduces acid production.
Okay, so they're kind of like antihistamines for your stomach.
Yeah, you could think of it that way. They can be pretty helpful for ulcers and also for GERD, gastroesophageal reflux disease, which is essentially heartburn.
Yeah, I've definitely had my share of heartburn. Are those available over the counter?
You can get lower doses over the counter for occasional heartburn, yeah.
Yeah.
But they only seem to work for about 50% of people with GERD.
Really?
Yeah. And they can also interact with other medications in some pretty significant ways. For example, cimetidine can inhibit the P450 enzyme system in the liver, which is involved in metabolizing a lot of different drugs.
Oh, so it's like it can mess with how your body processes other medications.
Exactly. So if you're taking something like warfarin, which is a blood thinner, cimetidine can actually increase the levels of warfarin in your blood, making you more likely to bleed.
Wow, that's pretty serious. Are there other examples like that?
Yeah, it can also interfere with phenytoin,
Mm-hmm.
which is used to treat seizures, and clopidogrel, which is another blood thinner. And it can also reduce the effectiveness of drugs that need an acidic environment to be absorbed properly, like ketoconazole and antifungal medication.
Okay, so H2 antagonists can be helpful, but they can also have some pretty significant downsides.
That's right. So these days, the preferred treatment for reducing stomach acid is usually proton pump inhibitors, or PPIs.
Like omeprazole. I see commercials for that one all the time.
Yeah, omeprazole is a very common PPI. And they work by directly blocking the proton pump, which is essentially the little machine in your stomach cells that pumps acid into the stomach.
So they're like shutting down the acid production at the source.
Pretty much.
Yeah.
And they're incredibly effective. They can block over 90% of acid production, both the baseline production and the surge that happens after you eat.
Wow, that's way more effective than the H2 antagonists.
It is. And that's why they're the go-to treatment now for a lot of conditions like stress ulcers, GERD that's causing damage to the esophagus, and active duodenal ulcers.
Okay, but do they have any downsides? It seems like any medication that's that powerful is bound to have some side effects.
You're right. There are some potential downsides to be aware of. For one, some PPIs, like omeprazole, can also inhibit that same CYP2C19 enzyme that cimetidine does. So if you're taking clopidogrel, it might not work as well.
Okay, so that's something to be aware of.
Definitely. And there's also a possible increased risk of bone fractures with long-term PPI use.
Really? How does that work?
It's thought to be because PPIs reduce the absorption of calcium carbonate, which is a common form of calcium in supplements.
Oh, I see. Because if your stomach is less acidic, the calcium can't be absorbed as well.
Exactly. And the lecture also mentioned that PTIs might increase the risk of diarrhea and C. difficile colitis, although those side effects are less common.
Got it. So we've talked about how to deal with the H. pylori infection and how to reduce stomach acid. But what about protecting the stomach lining itself?
Right, so there are a couple of other types of medications that can help with that. One is antacids.
Like Tums?
Exactly. Tums are calcium carbonate, which is one type of antacid. There's also aluminum hydroxide and magnesium hydroxide.
And they just basically neutralize the acid that's already in the stomach.
Yep, they're weak bases that work by directly neutralizing the acid. So they can provide pretty quick relief from the burning pain of ulcers or heartburn.
And you usually take them after meals, right?
That's right, because that's when acid production is highest. But there are some side effects to be aware of. Aluminum hydroxide can cause constipation, while magnesium hydroxide can cause diarrhea.
Oh, the irony.
Yeah, and people with kidney problems need to be careful with antacids too.
Okay, so what's the other type of medication that can protect the stomach lining?
That would be sucralfate.
Sucralfate. Okay. How does that work?
It's actually pretty cool. It binds to positively charged proteins in the stomach lining, both healthy and damaged areas. But it binds more strongly to the damaged areas, forming a sort of protective barrier over the ulcer.
So it's like a bandage for your stomach.
Exactly. And that barrier helps to shield the ulcer from further damage by acid and pepsin, which is an enzyme that helps break down proteins in the stomach.
Makes sense. Any downsides to sucralfate?
Just one main one. It needs an acidic environment to work properly. So you can't take it at the same time as PPIs, H2 antagonists, or even antacids, because those drugs reduce stomach acid.
Oh, right. That makes sense. So you'd have to take it at a different time.
Exactly.
Okay, so we've covered peptic ulcers pretty thoroughly. Let's move on to another tough one, chemotherapy-induced nausea and vomiting. The lecture mentioned that something like 70 to 80% of chemo patients experience this.
Yeah, it's a really common and really unpleasant side effect of chemo, and it can make it really hard for patients to eat, stay hydrated, and even stick to their treatment plan.
So how does chemo actually cause nausea and vomiting?
Well, it's a little complicated, but basically, chemo drugs can trigger the vomiting reflex in a few different ways. Some chemo drugs can directly stimulate the chemoreceptor trigger zone, or CTZ, which is an area in the brainstem that's involved in nausea and vomiting.
Okay, so the drugs are basically telling your brain to make you throw up.
Yeah, that's one way to think about it. Yeah. But it can also happen indirectly. For example, some chemo drugs damage the cells in the lining of the gut, which releases serotonin. And serotonin can then stimulate the vagus nerve, which sends signals to the brain that can trigger nausea and vomiting.
So it's like your gut is telling your brain that something's wrong.
Exactly. And then there's also the psychological aspect. Some patients develop a conditioned response, where the sight or smell of the chemo drugs, or even the clinic itself, can trigger nausea and vomiting.
Oh, wow. So it's like their brain has learned to associate those things with feeling sick.
Yeah, that can definitely happen.
So how do you treat chemo-induced nausea and vomiting?
Well, there are several different classes of drugs that can help. One is phenothiazines, like promethazine. They work by blocking dopamine receptors in the CTZ.
So they're kind of like antipsychotics?
Yeah, they can have antipsychotic effects, but at lower doses, they can also be effective for nausea and vomiting.
Okay. And then there are the 5-HT3 receptor antagonists like ondansetron. I've heard of that one.
Yeah, ondansetron is very commonly used, and they work by blocking serotonin receptors, both in the gut and in the brain.
So they're blocking the serotonin that's being released from the damaged gut cells.
Exactly. And they're very effective. They can prevent vomiting in about 50 to 60% of patients.
That's great.
Yeah. And they're also used for post-operative nausea and vomiting.
Makes sense.
There are also butyraphenos, like haloperidol.
Which are also antipsychotics, right?
That's right. And they also have some antiemetic effects. Droperidol, another butyraphenone, used to be used for sedation, but it's not as common now.
Okay. What about aprepitant? The lecture mentioned that one.
Yeah, aprepitant is a newer type of drug called an NK1 receptor antagonist. It works by blocking a substance called substance P in the brain.
And substance P is involved in nausea and vomiting.
Exactly. And aprepitant is really good at preventing delayed nausea and vomiting, which can happen a day or two after chemo. It's often given along with dexamethasone, which is a corticosteroid, and a 5-HT3 antagonist like ondansetron.
So it's like a triple whammy against nausea.
Yeah, pretty much.
Hmm.
And it seems to be very effective.
Okay, let's move on to diarrhea. That's another one that pretty much everyone has experienced at some point.
Oh, yeah, for sure.
So what are the main treatments for diarrhea?
Well, there are a few different approaches. One is to use antimotility agents, like loperamide.
I think I have taken loperamide before. Doesn't it have something to do with opioids?
You're right, loperamide is actually structurally similar to meperidine, which is an opioid pain medication. But at the doses used for diarrhea, it doesn't have the same pain-relieving or euphoric effects.
So how does it work for diarrhea?
It works by activating opioid receptors in the gut, which slows down the contractions of the intestinal muscles. This gives more time for water to be absorbed, so the stools become less watery and less frequent.
Okay, so it's basically slowing down the movement of stuff through your intestines.
Exactly. But there are some cautions with loperamide. You shouldn't use it in very young children or in cases of severe colitis because it can increase the risk of a serious condition called toxic megacolon.
Got it. What about other treatments for diarrhea?
There are also adsorbents like aluminum hydroxide.
Isn't that also an antacid?
It is, but it can also be used for diarrhea. It's thought to work by binding to toxins and microorganisms in the gut, kind of like a sponge.
So it's absorbing the bad stuff.
Exactly. But they're not as effective as the antimotility agents, and they can interfere with the absorption of other medications.
Okay, so that's something to keep in mind.
Definitely. And then there's bismuth subsalicylate.
Like Pepto-Bismol.
Yep, that's the one. It's often used for traveler's diarrhea. It has a few different mechanisms of action. It reduces fluid secretion in the gut, it has some antimicrobial effects, and it also coats the lining of the gut.
Okay, so it's kind of a multi-pronged approach.
Exactly. And it can cause a temporary blackening of the tongue and stools, which is harmless, but can be a little surprising.
Yeah, I've heard of that.
Lastly, we have constipation.
Ah, the opposite problem.
Right? And the main treatment for constipation is laxatives.
Yeah, that makes sense.
Laxatives work by speeding up the movement of stool through the intestines.
So they're like the opposite of loperamide.
Exactly. There are a lot of different types of laxatives. Some common ones include magnesium citrate, Miralax, and sorbitol.
Okay, so there are a lot of options for dealing with constipation.
Yep, and your doctor can help you figure out which one is right for you.
So to wrap up, today we've learned about peptic ulcers, chemotherapy-induced nausea and vomiting, diarrhea, and constipation.
That's right. And we've talked about the main medications used to treat these conditions and how they work.
It's amazing how many different medications there are and how complex the digestive system is.
It really is. And it makes you wonder, what other factors might influence how well these treatments work for different people?
Yeah, like genetics or diet or other medications they might be taking.
Exactly. There's still so much we don't know.
Thanks for joining us for this deep dive into tummy troubles and their treatments. Until next time.
See you then.
Bye.